So my name is Claire Betker, and I am here today actually with two hats on. So I am the Scientific Director for the National Collaborating Center for Determinants of Health, who is co-hosting this webinar called Advocacy and Government Relations, Strategies from the Field, with the Canadian Nurses Association, of which I am the president of the Canadian Nurses Association. I'm a registered nurse and the president until June of 2020. So I'm thrilled to be here today. I'm going to advance the slides here. So that's a photo of me. I'm a registered nurse, and I'm pleased to co-host or co-facilitate with AsherCorps Teta from our center. AsherCorps has been absolutely invaluable in helping us coordinate and set up the webinar today. So welcome everybody, and we'll get going. So the National Collaborating Center for Determinants of Health, as I know many of you know, is one of 6 collaborating centers located across the country, across Canada, that have been funded for around 15 years now. And actually the funding is from the Public Health Agency of Canada and occurred and began right after the SARS outbreak, along with other things like the establishment of the Public Health Agency of Canada and the establishment of the Chief Public Health Officer for Canada, who is currently Dr. Teresa Tam. So I know right now, in terms of the outbreak, the COVID-19 outbreak, we are looking for that leadership and that guidance across the country. So we're located in Antigonish, Nova Scotia, and so I want to acknowledge the land on which the National Collaborating Center for Determinants of Health is located. We're hosted, very generously hosted by the St. FX University in Antigonish, Nova Scotia. So we're located on the ancestral and unceded territory. We're in Mi'kmaq of the Mi'kmaq people. And that territory is covered by the Treaties of Peace and Friendship, which the Mi'kmaq and the Maliseet peoples first signed with the British Crown in 1725, so almost 200 years ago. And those treaties did not deal with surrender of land and resources, but in fact recognized the Mi'kmaq and the Maliseet title and established the rules for what was to be an ongoing relationship between nations. And I want to acknowledge the privilege of being a visitor in that place, and it's a very beautiful space and a very beautiful part of our country. So the National Collaborating Center for Determinants of Health, our focus is to enable action on both the structural, which requires policy, and social conditions that influence health, and we also work to narrow the equity gap between and across society. Our audience, for the most part, is Canada's Canadian public health organizations and practitioners, but I know that online today we have a number of other organizations, and we welcome you to our audience today and to this webinar. And in our work, we're a knowledge translation center, part of one of those 6 centers across Canada, and simply we look to share what's known to influence health for everyone through your work, wherever you find yourself working in our system. So we're thrilled, as I said, to partner with the Canadian Nurses Association today. And the objectives that we set collaboratively for today's webinar is to help all of us to learn a little bit more about government relations and what advocacy entails. It is a core role, a core competency for public health practitioners in Canada, and has been so for more than 10 years, as stated in our core competencies. Learn about how to engage politicians and government decision makers through various government relations activities and advocacy. And as the president, I've had a distinct privilege to work with both Michael and Sarah, who are going to speak today, in many opportunities to influence or persuade or try to advocate for different policies in terms of government relations. And so Michael and Sarah are going to share some of those, that work that CNA has been doing, and also their role. and then maybe talk a little bit about how to get involved and how we can support the Canadian Nurses Association and other organizations, for example, the Canadian Public Health Association and their advocacy efforts. So I'm going to introduce Michael and Sarah. I'm going to start with Michael Villeneuve. He's a registered nurse. And he's been a registered nurse for, he says, 4 decades. So coming on 40 years. I've been a registered nurse longer than him, though, so I win that competition. And Michael's had a really interesting career, and it spanned many domains of what we would consider domains of nursing. So from point of care, direct care, administration, education within the academic environment, research. And I think today, and I think what I see as Michael works as the CEO of the Canadian Nurses Association is his really solid understanding of policy, policy development, and how to work with governments around the establishment of that policy. So he's been our Chief Executive Officer of the Canadian Nurses Association for coming on 3 years in June of 2020. Just a couple of things about Michael. He's the author of Public Policy in Canadian Nursing, Lessons from the Field. It's an excellent book. It was published in 2017, so I'd encourage you to look for that book. But another thing is that in 2018, the Canadian publication, The Hill Times, listed Michael as one of the top 100 lobbyists in Ottawa, which was a really distinct honor. But as Michael always says, he didn't do that on his own. He's had a very, very strong team working with him. And one of those strong people is Sarah Nolan, and she'll be speaking today because she's the lead for government relations at the Canadian Nurses Association, having joined the team just about 1 year ago, and certainly has made her impact and her presence felt within the organization. And Sarah's responsible for providing insight and strategic advice to the broader association, including the officers, of which the president, president-elect, and our board of directors have benefited from Sarah's expertise and her insight and strategic advice. Prior to coming to CNA, she worked for 10 years in federal politics for various members of parliament and ministers on files ranging from human resource development, foreign affairs and international trade, and the status of women and industry. So I'm going to turn it over to Sarah and Michael, and the format for today is they're going to speak a bit from their experience and from what they're currently doing. We've got a couple of polling questions for you, and then we're going to open it up for questions, hopefully with about 10 minutes left at the end there. So please be thinking about your questions, start to type them in if you'd like, and we'll proceed. I just want to thank you for, when you registered, for indicating what you wanted to learn today. And we've taken those perspectives that you typed into the registration form quite seriously. So we hope we've crafted a webinar today that will meet your needs. Okay, go ahead, Michael and Sarah. Welcome.